Okay, today my review would like to talk about depression. You know that depression disorder is the common mental disorder. It involves a depressed mood or loss of pleasure or increase in activity for long periods of time. The clinical definition based on the edition of a diagnostic and statistical manual of mental health disorder, DSM-5. Okay, is a period of at least 2 weeks when a person experiences a depressed mood or loss of interest or pleasure in daily activity and had a majority of specific symptoms such as problem with sleep, eating, energy, concentration, and shower. This definition is slow breath after morning. Okay, and depression is different from regular mood change and feeling about everyday life. It can affect on aspect of life, including relationship with family, friends, and community. And it can result from a little problem at school and at work. Okay, you feel alone, but you have lots of company. And depression can stick around for years if left untreated, and can lead to physical symptoms and even thought of suicide. Okay, and you know that depression can happen to everyone, and people who have lived through abuse, severe loss, or other stressful are more likely to have developed depression. Women are more likely to have depression than men. And an estimated 3.8% of the population experience depression, including 5% of adults and 4% of men and 6% of the women, and 5.7% of adults older than 30 years. Approximately 280 million people in the world have depression. Depression is about 50% common more among women than among men. And more than 700,000 people die due to suicide every year, and suicide is the fourth leading causes of death in the 15 to 29 years old. Okay, and this slide the data about depression in Australia. You can see that in Australia, about 1 billion people suffer from depression each year, and around 1 in 7 will experience at least one episode of depression in their lifetime. Okay, 10 to 15% of the population suffer from depression worldwide, and depression is the leading cause of disability worldwide, and 1 in 7 Australians will experience depression in their lifetime. And depression is the third highest burden of disease in Australia. And depression is nearly twice as common in women than men, and if untreated, depression is a risk factor for dementia.
I will now present the cause and the risk factor of depression. Have many causes of depression, such as abuse. Physical, sexual abuse can make you more vulnerable to depression later in life. The postpartum. This is a major cause of depression in the new mothers. It refers to used to the youth physical change and drastic growth in hormone, glycerol, and estrogen. The certain medication, such as isotretinoin, interferon-alpha, and corticosteroid, can increase your risk of depression. The next, the conflict. This is depression in someone have the biological vulnerability to this may result from biological colleague and dispute with family member or friends. The disorder of loss sadness. After this, a loved one gender, the woman are about try as clearly as men to become depressed. The genius, a family history of depression may increase the risk. The serious illness, sometimes depression happens along with major illness or may be triggered by another medical condition. Substance misuse. Nearly 30% of the people with substance misuse problem also have major or clinical reason. Besides the cause, there are also risk factors. The risk factors for depression are multifactorial, but can be split into three broad categories of internal factors, external factors, and adverse life events. The risk factor for depression include female social isolation, being divorced or separated, lower socioeconomic status, medical condition, uncontrolled pain. Associated neurological conditions include epilepsy, multiple sclerosis, Alzheimer's disease, Parkinson's disease, cerebral vascular disease, and traumatic brain injuries.
Biologically, most medications focus specifically on neurotransmitters. Neurotransmitters are signaling molecules in the brain that are released by one neuron and received by receptor of another neuron. Essentially, a message is relayed from one neuron to the next. Regulation of how many of the neurotransmitters are being sent between neurons at any given time is thought to play a super important role in the development of systems of direction, since they are likely involved in the regulating a lot of brain functions like mood, attention, sleep, appetite, and cognizing. The three main neurotransmitters that we focus on for direction are serotonin, norepinephrine, and dopamine that cause there to be more of the neurotransmitters in the synapse cleft. The space between the neuron and so to be effective antidepressants. And this finding led to researchers to develop the monoamine deficiency theory, which say that the underlying basic direction is low level of serotonin, norepinephrine, and dopamine, which are called monoamine because they have one amine group. Additionally, it's thought that each of them might have an impact on certain sets of systems with direction, like norepinephrine on excitement or attention, like serotonin on obsession and compulsions, like dopamine on attention, motivation, and pleasure. So, if one of these is down, that could lead to set up specific symptoms being felt by the patient.
In this section, we will talk about types of depression. The first type is major depression. You might have this type if you feel depressed most of the time for most days of the week. The doctor might diagnose you with major depression if you have 5 or more of these symptoms on most days for 2 weeks or longer. At least one of these symptoms must be a depressed mood or loss of interest in activity. Major depression looks differently in different people, depending on how your depression makes you feel. It could be anxious distress. You feel tense and breathless most days. You have trouble concentrating because you worry that something awful could happen, and you feel like you might lose control of yourself. Agitated. You feel uneasy most of the time. You may also talk a lot, move for no reason, like fidgeting your hands and pacing around the room, act impulsively. Melancholy. You feel intensely sad and lose interest in activity that you used to enjoy. You feel bad even when good things happen. You might also feel particularly down in the morning, lose weight, sleep poorly, have suicidal thoughts. If you have melancholic depression, your symptoms might be worse in the morning when you first wake up. The second type is persistent depression. If you have depression that lasts for 2 years or longer, it's called persistent depressive disorder. This term is used to describe two conditions previously known as dysthymia, low-grade persistent depression, and chronic major depression. You may have symptoms such as change in your appetite, not eating enough, or overeating, sleeping too much or too little, lack of energy or fatigue, low self-esteem, trouble concentrating, or making decisions, feeling hopeless. The third type is bipolar depression. Someone with bipolar disorder, which is also sometimes called manic depression, has mood episodes that range from extreme of high energy with an up mood to low depressive period. Bipolar disorder is a mood disorder characterized by periods of abnormally elevated mood known as mania. These periods can be mild, called hypomania, or they can be so extreme as to cause marked impairment with a person's life, require hospitalization, or affect a person's sense of reality. The vast majority of those with bipolar disorder also have episodes of major depression. When you're in the low phase, you will have the symptom of major depression. The fourth type is postpartum depression. Pregnancy can bring about significant hormonal shifts that can often affect a woman's mood. Depression can have its onset during pregnancy or following the birth of a child. Women who have major depression in the week and months after childbirth may have peripartum depression. Mood change, anxiety, irritability, and other symptoms are not uncommon after giving birth, and often lasting up to 2 weeks. Postpartum symptoms are more severe and longer lasting. Postpartum depression can range from a persistent lethargy and sadness that require medical treatment all the way up to postpartum psychosis, a condition in which the mood episode is accompanied by confusion, hallucination, or delusion. The fifth type is premenstrual dysphoria. Women with premenstrual dysphoric disorder have depression and other symptoms at the start of their period. Among the most common symptoms of premenstrual syndrome are irritability, fatigue, anxiety, moodiness, bloating, increased appetite, food craving, aches, and breath tenderness. The last one is atypical depression. It is characterized by experienced signs of depression, such as overeating, sleeping too much, or extreme sensitivity to rejection, but by suddenly perking up in face of a positive event. This type is different from the persistent sadness of typical depression. It is considered to be a procedure that describes a pattern of depressive symptoms. If you have a typical depression, a positive event can temporarily improve your mood.
The next, I will talk about special types of depression. Two types only in women is perinatal depression and premenstrual dysphoric disorder. Perinatal depression. This type of depression includes major and minor depressive episodes that occur during pregnancy or in the first 12 months after delivery, also known as postpartum depression. Premenstrual dysphoric disorder, also called PMDD. This type of depression is a severe form of premenstrual syndrome, or PMS. Symptoms of PMDD usually begin shortly after ovulation and once menstruation starts.
There are several non-birth treatments, also known as psychotherapeutic interventions. Here are some of them. The first one is cognitive behavioral therapy. is a widely used approach. By working with the therapist, individual can learn to reframe their thoughts and modify behavioral patterns. Interpersonal therapy is a short-term psychotherapy that involves three phases: diagnosis, identify issue, and develop a strategy to improve relationship. The third therapy is mindfulness-based cognitive therapy. It's a broad intervention that teaches mindfulness to prevent depressive relapse. It focuses on consciousness, emotional processing, and can personally help treat physical symptoms of disease. The next is psychodynamic therapy. It's a talk therapy based on the psychoanalysis. It focuses on the emotional impact of childhood development and utilize the therapist's patterns relationship to uncover problematic patterns. And the five is behavioral activation. Use behavior to improve emotional countering depression by engaging in positive activity. Individuals can break the circle of unpleasant feelings and reach a positive feedback loop. Number 6 is supportive therapy. It's aimed to elevate symptoms and improve self-esteem. The therapist help clients work through depression, concern, and offer radical advice in a safe and non-judgmental environment. A regular physical activity such as yoga, aerobics, and it has been shown to have positive effects on mood and can be helpful in managing mild and moderate depressions. To the light therapy, the light is both estimated through a light box. It helps to reduce symptoms of depression and regulate the sleep-wake cycle. And the last one is electroconvulsive therapy. It's used for severe depression. It involves electrical brain stimulation under anesthesia. It's triggering a control strategy that may reverse mental health symptoms.
When it comes to drugs and intervention for major depression disorder, we have many different kinds of medicine for depression, such as selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitor, tricyclic and tetracyclic antidepressant, atypical antidepressant, monoamide oxidase inhibitor, NMDA antagonist, GABA receptor positive modulator, and there are some types and some typical in each category A we can see in the table. And because of SSRI is the first choice of major depression disorder treatment, we have to illustrate the basic mechanism of this drug. In general, antidepressant function by increasing the availability of monoamides such as serotonin, noradrenaline, and dopamine in the synapse, and the monoamides are thought to be depleted in depression. SSRIs and SNRI and TCAS achieved by blocking one or more of the monoamide transporter, so that preventing the neurotransmitter from being taken back into the actin terminal that released them. And it's just an overview about drugs and current guidelines to treatment major depression disorder patient, and another problem that less intervention. And you can not always prevent clinical depression, but you can have reduced your risk by getting quality sleep and having a healthy sleep routine, managing stress and healthy coping mechanism, practicing regular self-care activities such as exercise, meditation, and yoga, managing any underlying medical and mental health condition you have, avoiding misuse of alcohol and other substances. And this is an overview of drugs and prevention in major depression disorder. Thanks for listening.